الله السميع العليم من الشيطان الرجيم. بسم الله الرحمن الرحيم. الحمد لله العالمين والصلاة والسلام على سيد المرسلين سيدنا محمد وعلى آله وصحبه أجمعين. بشرح لي صدري ويسر لي أمري واحلل عقدة من لساني يفقهوا قولي. السلام عليكم ورحمة الله وبركاته. At the beginning, let us start with recitation of Kitab Surah Al-Baqarah. أعوذ بالله من الشيطان الرجيم. بسم الله. Amin. Thank you very much, all of you, for being here. Without any further ado, I would like to invite Dr. Abdul Hashi, the Deputy Director for Islamization in Kuantan, to be the moderator for this session. Thank you very much.
Bismillah ar-Rahman ar-Rahim. Thank you very much, Associate Professor Dr. Akram, for organizing and calling for this session. And our speakers, Professor Jamal, Professor Ahmed Mabrouk, Assistant Professor Dr. Muhammad Safwan, and the participants, whether from IIUM or from the public. To all of you, Assalamu alaikum wa rahmatullahi wa barakatuh, and good morning. All of you are doing great this very early morning. I hope you have your breakfast, prepare it for the session to discuss about this important topic. Well, today the topic is COVID-19. Of course, this is the topic of the day, the topic of the morning, the topic of the moment, actually, for all of us. And this is a topic that we all like to talk about. Why? Because it has changed our life, economically, socially, and even it has risked, the life of many, and even it has taken the life of many globally, all around the world. So it became the topic of the day, and therefore we have to talk about it from different aspects, in terms of healthy care, and in terms of morality, in terms of the issues involved, matters, concerns. Yeah, because it has touched our life, therefore we have to talk about it. So, well, today people are asking so many questions. Well, they are asking about, what caused it. Of course, in the initial form, we were talking about what caused the COVID-19. But now people are talking about, is there a vaccination? Is there a way to deal with? Of course, when they talk about the way to deal with or stop it or finish with it, they are asking about the current available vaccinations of COVID-19. And this became the topic of the day for everyone, of all of us almost, everywhere in the world. So, well, there are concerns about the safety of the vaccinations, content, functions, prioritization of who will get, when, how to distribute the vaccinations when it's achieved, the level of the efficiency, 100%, which one to begin with. There are a number of, vaccinations appearing here and there. And people are asking which one to begin with, the Chinese vaccination, the Russian vaccination, the AstraZeneca vaccination, or Johnson & Johnson vaccination, or Pfizer, which one to begin with, or which one we should prioritize over the other. Well, besides those concerns, there are also questions about whether the content of the vaccination is actually, containing a halal content. The issue of which one comes first, is the halal content or the healthy care and life-saving content. So, well, then today is the session to talk about this. This is the day to talk about this, and I think Centuries has chosen this topic to address from healthy care perspective and also fiqh aspect. That's why we invited, the mentioned expertise to talk and discuss about this issue today. So before I begin with the speakers, our guests and expertise, I would like to invite our director, the director of Centuries, Center of Islamization, Associate Professor Dr. Akmal Khuzairi, to give some preliminary and opening remarks for our session today.
Bismillah ar-Rahman Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi ta'ala wabarakatuh. Thank you, Dr. Abdul Hashi, Dr. Akram, our respected panelists, Prof. Jamaluddin, Dr. Shafwan, Dr. Ahmad Mabruk, whose spirit I think is still with IUM, although that he has already left us, and the rest of our colleagues here in Gombak and also in Kuantan. Well, because of this
Dr. Akmal, I think there is a problem with your sound. I think you need to be closer to the mic.
Is it okay now?
Okay, yes.
Okay, yes. Well, thank you again to our panelists, Prof. Jamaluddin, Dr. Shafwan, and also Dr. Ahmad Mabruk, and the rest of our colleagues here in Gombak and also in Kuantan. First of all, we are organizing this program is because of the pressing issue that we are facing now in our society, that is to address some of the confusion, some of the platforms that people have been listening to and try to understand the current issue about COVID-19 vaccination. And there have been some views saying that it adds to more confusion than understanding. So because of this particular issue that has been developing, we take our own initiative to organize our own program in order to clarify what exactly is the truth. We are not merely stating opinions, but we want to state facts. So that is why. So that is why we are asking our experts, as mentioned in the Quran, "Fas'alu ahla dhikri in kuntum la ta'lamun." So ask the people with the message if you do not know. So that is what we are actually doing, try to gather some of the best in the respective fields to address this issue from the perspective of fiqh, from the perspective of public health, from perspective of clinical and some other issues perhaps that will prop up during the discussion. And it is also to add to the existing references on the COVID vaccination, references, information, to refute the myth, to correct the misunderstanding, to investigate. Perhaps there are some conspiracy theories lingering, and we hope we can clarify that through this small initiative that we plan to do, and hopefully it will also add to the reputation of our university in clarifying some of the public concerns that need to be addressed by educational institution like IUM. Thank you all. Thank you to our panelists, and we hope to benefit from the discussion. Barakallahu fikum. Assalamu alaikum warahmatullahi wabarakatuh.
Thank you very much, Associate Professor Dr. Akmal Huzairi, for your short and far-reaching remarks to open our session. And now I would like to move to the topics of discussion. As before I give the chance to our speakers, I would like to share with you the audience or the session. I would like to share with you the seminar will be divided into three major, into two major sections. The first section would be, the speakers giving their note, maybe about 15 to 20 minute discussion, presentation, and sharing their thoughts on given topics. Then I will proceed. Once the three panelists finish their presentation, then I will move to the second session, which is going to be, inshallah, a session of heart-to-heart discussion, whereby the audience and the participant have the chance to ask and raise their concerns to our panelists. And that would be either by, voice, whereby you can speak, inshallah, when you raise your hand, or you can put your questions in the chat. So then you mention, directly, maybe to whom you are directing your question to one of our, panelists. Even if you mention your question in the chat, you can also mention the name of the person or the panelist that you want to ask. So now we will begin the first session, which is more on presentation from our three panelists. And the three panelists, inshallah, I will start with Professor Jamal. Then I will proceed with, Professor Safwan, Assistant Professor Safwan, and then I will end with Professor Ahmed Mabruk. So I would like to now invite Professor Jamaluddin Abdul Rahman with the topic of vaccination, COVID-19 vaccinations and concerns of coping with the public health challenges. To go briefly in his biography, of course, very rich and very wide knowledge, but to go briefly to share with you his biography, Professor Jamaluddin bin Abdul Rahman is currently Deputy Dean, Postgraduate and Research, College of Medicine, IIUM. He is also a professor at the Department of College of Medicine, and he is a College of Medicine, IIUM, and he is also a board member, a member of Board of Governors of IIUM. Well, he has done his his bachelor, master's, and PhD in epidemiology and biostatistics in UKM. And his expertise is epidemiology and biostatistics as well. Professor Jamaluddin Abdul Rahman is a medical doctor who graduated from University Kebangsaan in Malaysia in 1995, as I mentioned just now. He is very rich. Where to begin his CV and biography? He obtained his 4-year Masters of Public Health and Public Health Specialist Program, sub-specializing in epidemiology and biostatistics in 2002, with a thesis entitled Survival Analysis of TB Patients in Terengganu. He was consultant in research methodology and biostatistics clinic in Clinic Research Center, Hospital Kuala Lumpur from 2008 to 2010. He was actively involved in many national-based surveys in the country, which included National Health Morbidity Survey in 2006 and 2011, National Oral Health Survey for Adults 2010, National Oral Health Survey for Preschool Children in 2015, a National E-Cigarette Survey in 2016. He was conferred a fellowship by Malaysian Public Health Physician Association in 2017, and he published a book entitled Brief Guidelines for Methods and Statistics in Medical Research in 2015, and chapter entitled Quantitative Method in Global Health Research in Handbook of Global Health Research in 2020. He had published more than 90 papers and with more than 700 citations. Currently, he is a member of COVID-19 Epidemiological Analysis and Strategies Task Force under MOSTI. Professor Jamaluddin, welcome to the discussion. The floor is yours.
Thank you, Dr. Razak. Thank you, Centris, for the invitation. So I will straight go to the topic of discussion. The topic given to me is the challenges that we're going to face in this COVID-19 outbreak. And our focus is mainly with regard to the vaccine. So I rephrase the topic given to me to something like whether or not the vaccine that now we have been talking about is the public health last hope. Because we have seen in Malaysia, for example, initially we are able to contain the outbreak, but over time we can see that the case now escalating very high. Now we have something like 3,000, 4,000 per day. So those are the things that we are going to talk whether vaccine is savior or not. For the start, let us go to the history. I will not going to mention everything. You can get this everywhere from the internet. But we know that everything started in December 2019 when the reported cases of pneumonia in Wuhan City, China. And then this is very important. If I want, I will stop only on the 10th of January. This is very important to our topic. You can see within 14 days, China government shared their complete SARS-CoV-2 genome to the world. So this is very important, timeline, important date that we have to remember. So the first reported cases was in 31st December. So less than, I would say, 10 days, China able to study the whole genome sequence and then share worldwide. So is it surprising? This create a lot of theory, conspiracy theory. Why is it so fast that we are able to get the whole genome for this particular virus? Actually, coronavirus is not something new. When we started to develop the vaccines or we started to study the virus, it's not something new. In 2002, we have SARS, which is actually SARS-CoV-1 virus. SARS coronavirus. So we have that virus since 2002. And SARS, of course, also started in China. And then for the whole 8 months, the number of cases was 8,000. 8,000 cases all over the world. And the mortality rate was almost 10%. So total cases, 8,000. And then after a while, the case disappear. And 10 years later, we have MERS, Middle East Respiratory Syndrome. So this is another virus coming in 10 years later. And total number of cases, 2,500. Again, from the same virus. And the mortality is very high, 34%. But it is confined only in certain areas of part of the world. And suddenly the case disappear. We are able to contain. Come 2019, we got this COVID-19. So at the moment, we have more than 100 million cases where almost 4% average, I would say, a case fatality rate, people who die. But of course, in Malaysia, the number of death rate is below 1%. But then there are some certain countries reported more than 25%. There's a reason, a statistical reason for that. But my point is that this virus is not new. This coronavirus is not new. Available in the country, in the world since 2002. And people developed the vaccine. Since then, they already had developed the vaccine. For example, like MERS, a few companies already developed vaccine for MERS. But since there is no more case, how can they test? If you are looking at the current scenario, the current vaccine that we have, Pfizer, for example, how many samples that they tested? 40,000. So from 40,000, they get how many infection rate? Of course, among there's a control group and then the treatment group. Among those not being given any vaccination, the infection rate is 1.5%, 1% to 1.5%. So they have to test 40,000 people to get 1 to 1.5% case, even though COVID-19 is so infectious. So meaning to say that currently, they know, I mean, the development of vaccine is not starting from zero. They are able to develop very fast. At the same time, because of the urgent need to get the vaccine, so there will be billions of dollars funding for vaccine parallel all over the world. So this is a very important point that I would like to first mention. Second, now I'm talking about the origin of the vaccine. Just we do not develop from scratch. We already have a complete sequence of it, but not exactly COV2, but later China share to the entire world. That's one important point. Second, before we start talking about COVID-19, the principle of managing outbreak is the same, regardless whatever outbreak. So in epidemiology, we rely on this triad, this triangle, the interaction between agent, host, and environment. So when we talk about agent in this part, this bit, you can see that I highlighted two important characteristics: the transmission rate, how fast the infection can spread, and also the clinical presentation. And then this part, the clinical presentation, is something that I would like to highlight after this, inshallah. So if I change this triangle into what can we do, this is the thing that has been done. How the agent spread into the environment, and how can we protect ourselves from the agent to host is human being, and of course how we can further prevent the spread. So there's a travel ban, and then this is SOP, prevention of mass gathering. So where is the vaccination? The vaccination should be here when we try to prevent the infection from the agent to host. So this is the role and the place for the vaccine. For the vaccines. So come with the same principle, I would like to mention here the important about this particular COVID-19 situation, clinical presentation. The most difficult part for public health is because most of the cases presented with asymptomatic. Some people report as high as 60%, 50%, 70%. In Malaysia, certain area, there are even 80% asymptomatic cases. So they are tested positive, but then they don't have symptom until they become negative. No symptom at all. They tested positive and then they tested negative, but they never had any symptom. That is what we call asymptomatic. Of course, we have for symptomatic, pre-symptomatic, all those cases. But this is the one that really gives public health a huge challenge because we do not know our enemy. We can't see it. Compared to SARS, compared to MERS, their symptom is very prominent. A study done among those pre-symptomatic, the one that come without any symptom, tested positive, but later they become symptoms. So tested positive first, then they become positive. One of the finding they observe is that the virus shedding for COVID-19 upper airway compared to examples like influenza, for example, like SARS, they are lower tract, respiratory tract infection. Or for COVID is upper. So that's why the infections is very, very rapid and easy to spread. So that's why we have so many high infections rate. So this is the one that causing a lot of problem to us. So I will skip this part. This you have heard about the term containment, suppression, or mitigation. If you want to ask me, I can answer later. I don't want to take my colleagues' time, but I will straight away go to vaccines. So what is the role of vaccines? The role of vaccine obviously to trigger our antibody so that we will have our immunity. Therefore, we will not going to get the disease or succumb to the disease. There are two important roles of vaccines. One is to prevent us from getting the disease, or if we get the disease, the symptoms, the severity will be very, very low. So those are important with regard to vaccination. So now talk about data. Without vaccination, the infection rate I mentioned just now is around 1 to 1.5 in community. In, for example, like in working in factories in Selangor, we heard so many thousands of cases. There, the infection rate is 15%. 15%. So you take 100 people, 15 of them will get positive. But in community at the moment, the rate that we see is around 1 to 1.5%. So, but then studies shows that those taken vaccination, the infection rate for that group who took the vaccines will drop up to 0.1%. How is it this translate to our usual life? So if you look at, let's say in the gathering, the usual walimah, the usual wedding, normally we invite something like, in Malaysia, usually we invite maybe usually like 500, some of course will invite 1,000. Let's say we invite only 500 people. Normal, everybody, that the one that we know. If the infection rate was 1 to 1.5%, these 5 to 7 or 8 people who come to our gathering might already have COVID-19 that we do not know they have COVID-19. If you take, let's say, 5, let's say half of them maybe got asymptomatic. Of course,
Hilmi, I still haven't got you.
So those symptomatics perhaps will not come to our gathering. So asymptomatic maybe around 4 of them. So what happened to all the other visitors? They might get infection. But what if these 500 people already vaccinated? From 500 people, maybe none actually will have COVID-19 because 0.1% times 400 is 0.5. So maybe not even one. So what happened if we have a vaccination? So we can have our usual walimah, so the risk is very low. So perhaps government will open up, will allow our life at least nearer, closer to the norm that we have before COVID-19. So there's a number 2 I mentioned here. And of course, the rest I will not go into detail about the efficacy. I think this one you know already. This is a valid scientific research. And I want to mention here because we are in the university, but some of us, among academicians, very important for us to mention and to report the finding in great detail. We even share the data. And for those who really want to know how good the vaccines are, you can look all the source there. The paper is there, all the data is there, great detail. You can get the data. So if we believe that people try to manipulate findings, very difficult to manipulate because the data is very transparent. And for your information, for every single trial of this drug, they are registered and you can get every detailed information with regard to the trial from the website. They are very transparent. Even the current vaccine are being developed in Malaysia. Which one? I show you the second slide. This one, they have not published full data yet. Because this is from China mostly, do not really, including Johnson & Johnson, not publish the full report, the efficacy and safety yet. But last one, this is the one from, it comes, actually the one that currently being tested in Malaysia from inactivated vaccine. So they plan to test around 34,000 in total. Malaysia is one of the countries where they will have their trial. So, and then even this particular information about this, you can get a number of officers in charge in Malaysia in that particular website, all the registry of the trial. There is nothing hard, nothing hidden there. All the information is mentioned clearly with regard to the vaccines being developed and already developed. All right. So those are my third point with regard to the vaccines. Now, how good is vaccines? This is from history. I will not going to get actual data. It's from Encyclopedia Britannica, but this is a known fact all over the world. Diphtheria, polio, and measles, you can see the drop suddenly when they introduce the vaccination. And let's see what is the current situation of COVID-19. This is the trend now for COVID-19 all over the world. Okay, let's look into the country that taken up vaccination. At the moment, the country that leading in taking to immunize the population is Israel. To date, more than 60% of their population, of course, their population is not many, around 5 million, okay? But they have immunized more than 60% of the people. And then next after them is two important countries, the UK and the US. The rest is not so much, but they have already started the vaccination program. Let's look Israel, what happened to their countries. They started in January, late January. You look at the bi-weekly confirmed cases, around January, what happened? The numbers start to drop. Having said that, last week, they already have their third lockdown enforced. Even though they vaccinated, they have a strict SOP perhaps. So they even have the third lockdown when they have slightly raised of cases. My comment is that the result looks promising. However, for me, it's still too early to see confidently to say that the effect of vaccines, but it is still positive. Looking at one country, because we have to wait for other countries to show their result. But we can see a very promising result. So answering my own question, is vaccine our last hope? I believe as a Muslim, very important that our hope should lies only with Allah, not vaccine, not public health, not ministers, not anybody. Our hope, we should put only our hope, trust only to Allah. Those are the very important thing that we have to rely on, not vaccine. Vaccine is one of the way one of the way that we know is good to solve this problem. Something that we believe it is okay, so we should also support the idea. But our yakin, our iman should be lies on Allah. And regarding hygiene, everything, I think we know that Islam encourage all those things. So no, we have more things that we can done, and vaccine is not the last thing that we should put our hope for. There are a lot of things we can do. I can mention a lot of detail about this. I will not going to move on, Dr. Razak. I will stop here. So, but basically, there are a lot of things we can do in future. Okay, so we don't have to rely only on vaccine. A lot of things we can do. Vaccine is one of the important way we can adopt. That's all from me. Thank you. Assalamualaikum.
Alaikum salam. Thank you very much, Professor Jamal. Very straightforward and I think enlightening beginning of the session. Thank you very much for that, for sharing those information. I think the idea of looking into the agent, host, and environment, as well as the role of environment, what do you call vaccination, whereby life might come back to normal. That is very powerful, you know, what do you call it, statement, and sharing also with us the published up to now, the published and produced vaccinations. Well, now I would like to invite, you know, because the topic here not only includes the public health as illustrated beautifully and nicely by Prof. Jamal, it also, our session contains the issue of the vaccination itself, the component and the function. You know, what is, you know, of course, some of the vaccinations are derived from viral, you know, they call virus mutated, some, you know, the content, the people are worried about the inside, the elements of the vaccination itself, because we know they are derived from different sources, the vaccinations. So, well, people are asking, what does, you know, these vaccinations made of, or what do these vaccinations are made of? And then they are asking again, what is the level of efficiency? Are they all effective? And then they are asking how they function actually, basically how they function in the body, as well as the clinical safety as well. So I think the best person to answer that, as although Prof. Jamal, I think, touched some parts of it, but also another, you know, speaker who is going to touch as well is Assistant Professor Dr. Muhammad Safwan, the head of emergency medicine, Kulia of Medicine, head of emergency and also trauma department, Sultan Ahmed Shah Medical Center, SMED. He is now, the head of both, departments in the Kulia and also the hospital, the emergency and, Department of Emergency, sorry, to repeat that on that. His expertise is emergency medicine. Research interest is actually disaster management, and interested in disaster medicine as well as clinical care medicine. And he is now also he is the founder of Emergency Disaster and Crisis Center in SESMED. That runs all the COVID-19 related activities also since the beginning of the pandemic in 2019. So, well, Dr. Safwan, the floor is yours. It's very lengthy and very rich CV. I wish I can read more, but I think, yeah, we have a time pressure. So welcome to the floor. Please go ahead. Dr. Muhammad Safwan, are you there? We can hear the voice. Can you hear my voice, Dr.
All right, can you hear me now?
Yep. Now we can hear you.
I'm so sorry, I was looking at the unmute button. All right, thank you, Dr. Ashif, for the kind introduction. So as a part of emergency department, we actually have been dealing with COVID-19 since the very beginning. Of course, for the past 1 year, it has been a roller coaster ride for us, right? There's ups and downs in management of COVID-19. So last year, I think we did this similar talk, but we talk more on COVID-19. At the end of that discussion, we talk about the importance of vaccines. Inshallah, it will be there somewhere around 2 to 3 years. But here we are talking about vaccine after 1 year. Okay, this is actually a little bit of development for us. I think it's a history for the nation, for the humankind actually, to get this kind of vaccine in as this fast. Okay, so last year actually, the Minister of Health had been doing a survey for the Malaysians for their acceptance in in vaccination. So these are the 200,000 respondents respond to that survey, in which 67% said that they will take the vaccines, 16% they put a full stop that they're not going to take the vaccine, and 17% are a little bit unsure. So this is reflected way back in December, where the knowledge is actually not there at a lot. No, I mean a lot. The data is not there yet. So our earlier, Prof. Jamal, our earlier survey from what is it again? Slido. What was that again? What is the final result?
The final result, yes, only 47%. Not
Okay.
sure, 40%. Not going to take is 12%.
All right. It's a little bit worse than this actually. But yeah, there's a very small numbers of respondents. But still, the number of those who don't want to take the vaccine is actually around there. It's just the 50-50 unsure group that think that they want to take, but for some reason, there's a lot of other things that they take into consideration. I think we should not blame those who are very skeptical, because these are confusing period. Okay, instead of forcing, I think we need to educate. We need to understand. We need them to understand that if they did not take, if they decide not to take the vaccine, it is not only will affect themselves, it will affect the community. Because of course, I think Prof. Jamal mentioned this. We need to create a herd immunity, right, to get nearly 70 to 80% of our population vaccinated. So yeah, that is the issue now. So just to recap, Up to today, we have 106 million cases of nearly 107 million of cases worldwide, globally, for the past 1 year. And total numbers of that is actually 2.3 million for single disease for a year. For Malaysia itself, we have 245,000 cases, and till today we had 896 deaths, and we recorded the largest number of deaths yesterday, over 24 hours, right? So we are not doing that bad actually, because the number is actually, the death rate is 0.4%, in which correspond to nearly 4 in every 10,000 cases. Okay, so let's just jump back into the vaccines. Okay, if you look into vaccines that is available, this is the kind of vaccine that was available for COVID-19. There's a lot of things actually happened. The race actually happened way back earlier this year. So a lot of companies went into develop their own vaccines. So I just want to go a little bit on the live attenuated, on the type of vaccine. We have live attenuated vaccines. Previously, we used this kind of vaccine in measles, mumps, rubella, and also chickenpox. There's two company that use this method for COVID-19 vaccine, which is not yet there yet in the clinical trials stage 3. The inactivated. Previously, we used this in polio. There's two companies using this method, which is a Sinovac and also Sinopharm. The subunit type of vaccine is actually we use in pertussis and also hepatitis C, and as well as human papillomavirus, HPV. The one that use this type of vaccine is the Novavax. And there's one more thing, there's one more types of vaccine which is not here, is the viral vectors. Viral vector is technically being used previously in Ebola, and now it was taken by AstraZeneca and Oxford, and also as well as Johnson & Johnson. Last but not least is the RNA or DNA vaccines, which everyone's aware of or about this vaccine, in which we don't have any history of using this kind of vaccines before. There's no, well, I'll say, general products of RNA and vaccine in the community. So Pfizer, BioNTech, and also Moderna are using this type of vaccine. Despite of no history previously, production of large amount of vaccines, they are as well the fastest vaccine that ever been developed by the history of humankind. So if you look into the traditional process and development of vaccines, you're going to see like there's taking few years for preclinical studies, and then they will send for investigational new drugs, went into the clinical trials, phase 1, phase 2, and phase 3, before sending for regulatory review by FDA, and started the large-scale production. What happened in SARS-CoV-2, as Dr. Prof. Jamal said, we are not actually starting from scratch. We have already had the knowledge of SARS-CoV-1 in 2002, MERS-CoV in 2012, and now the SARS-CoV-2. The thing is, when Prof. Jamal said that they actually, when China shared the gene, that is really an important event. It's really an important event because the preclinical trial have been started since then. Okay, when they study this both SARS-CoV-1 and SARS-CoV-2, they noted both actually shared 79.5 gene sequence, which is quite identity with the two. It's not exactly, but it is there. So basic research on the transport, on the lipid profile of the vaccine, it was done 25 years back, actually. For the past 10 to 15 years, the lipid profile for this mRNA vaccine, I'm just going to talk about the mRNA vaccine. It is actually done, it was actually developed for the past 10 to 15 years, in which the main aim for the use of that lipid nanoparticles is for bringing up the cancer vaccines, actually, to develop the cancer vaccine. Of course, the parallel, if you see the phase 1, phase 2, phase 3 is different. They move concurrently. These are actually, if you see the phase 1, before they end the phase 1, they started the phase 2. and then before they start the phase 2 and they start the phase 3, during the phase 3 already production is there. That is this method the development of the vaccines early. But if you can see that there's no shortcut in development of the vaccine, both vaccine need to go to phase 1, phase 2, and phase 3 trial, and both need to be reviewed by the FDA and also other bodies. All right, these are the race for COVID-19. If you can see the preclinical, there's a lot of company that went into the research. As the phase progressed, only a few of them. And if you can see here, since May, AstraZeneca, Pfizer and BioNTech has started the trial and get their result on the November, and the approval is actually was got in December 2020. This is followed by Moderna, AstraZeneca, Novavax, and Johnson & Johnson. Despite this FDA approval reviews, if you can see all these small dots here, these are actually reviewed by country that going to use the Pfizer BioNTech. Malaysia have our own. All medication that come for all medication, including vaccines that come into the country, need to be reviewed by the DCA, the Drug Control Authority, and these drugs will be reviewed by the National Pharmaceutical Regulatory Agency. They will look into the three things actually. The first is the safety of the drugs. Number 2, the efficacy of the drugs. Number 3 is actually the quality of the drug. And then they will present to DCA before it will be approved for it to be used in the country. So that is the process of getting the vaccines done and ready. Okay, I'm going to talk about mainly the mRNA vaccines, because this is what we're going to get end of this month. There's a lot more vaccine actually. The content are different. However, if you want to go one by one, it's going to take a long time. So I just want to stick and tell you guys what we're going to get, okay, for the next month. So we're going to get the Pfizer BioNTech vaccine, which is the mRNA vaccines. In mRNA vaccine, if you look into the fact sheet, you're going to find that there's a few things inside the vaccines. One is actually the mRNA peptide. mRNA stands for messenger RNA peptide. Okay, the number 2 is the lipid. All right, so lipids, there's a few components inside it. Okay, mainly it's just some sort of cholesterol. It's a lipid profile. Otherwise, the potassium chloride, the rest of the thing is actually the buffer for the vaccine. Okay, if you look at this, the mRNA is actually derived from the COVID-19 DNA. It derived from the COVID-19 DNA. We sequence only the spike protein. If you remember the COVID-19, it have the nucleus, the encapsulated nucleus, the shell, and as well the spike protein. The mRNA is only sequenced for the spike protein. So if your body read the mRNA, they will create the spike protein. All right. So I'm going to talk a little bit on this. I'm going to take some time on this slide, because this is how to explain how your body react to that vaccine actually. I'm going to split it into two actually. The one with all the medical terms. The other one is the analogy for those who might not understand the clinical terms only. So as I mentioned before, the RNA is actually encode only the spike protein and enclosed by the RNA. They will be injected into your muscle, usually your deltoid muscle, right? So the mRNA will be released into your, the lipid is actually the transport, and it will bind to your cells and release the mRNA, the messenger RNA, which only coded for the spike protein, not the whole of the COVID-19 virus. Okay, if you have a little bit of understanding of cellular anatomy, you will understand that the nucleus, each and every one of us have a nucleus, and in the nucleus there is a DNA. To produce a protein from DNA, the DNA will be read and also will be sent to your cell to create as a form of mRNA to create protein, whatever protein it is, say hormones, say enzyme, and all those things. The same exact mechanism was given, but this is the mRNA from the virus. was put into the cell, but not going into the nucleus, so that your cells can create its own spike protein. But this spike protein is known to your cells that it is not your own protein, it's a foreign protein. So what they will do, they will put it at the surface through certain receptors, and then come your immune receptors, immune cells that that will read the spike protein and create antibody, and as well as create a memory cells from the B and T cells. The antibody is simply a protein that will bind to the virus if they had the virus in mind, so that the virus will not infect the cells. And the T cells is actually the cytotoxic T cells will have the configuration in which if the virus have went into the cell, it will recognize the cells and kill the cell, okay, and prevent the replication of the virus, and as well as production of protein that might cause harmful for your body. Both B cells and T cells will have their memory cells for immunity in the long run, such as few months or few years. Okay, that is the scientific way to tell you guys. So I'm just gonna give the analogy to make it simple. Right? You need to remember that your body is like a country maybe. So you have the heart, like your TNB, your Tenaga Nasional Berhad. You have your bladder, your Jabatan Air. You have your bowel, is your what you call this, the Indah water maybe, right? And your brain is like the parliament. Okay, then in your body, they need an army as well, right? So if someone came into your country, someone meant to do something bad, there will be a response, but it's going to take some time, because that response will go through your, say, 999, call the police is going to go there, and sometimes the guy is actually passed through you, and you are not recognizing the thing. So you go there, and then you notice the person, and then you develop alarm system for that. What vaccine did is actually give the poster to your army, right? Give poster to recognize early. So when you get the poster, you recognize, oh, this is the guy, so you can respond early. That's all the analogy is actually for the vaccine, right? All right, we're going to talk a little bit on the efficacy of the vaccine. Of course, when we talk about efficacy, there's two things. Efficacy on preventing the disease, efficacy on transmission of the disease. Okay, we have little knowledge about the transmission of efficacy on the transmission of the disease, but efficacy in preventing the disease or severe form of the disease are well written, as what Prof. Jamal have said before. If you look into Pfizer, BioNTech, the mRNA vaccine, they measure the efficacy in preventing onset of COVID-19 after 7 days of second dose, which carries 95%. Moderna shows efficacy of vaccine in preventing first occurrence of symptomatic COVID-19 in 14 days after second dose, which shows 94.1% efficacy. AstraZeneca have their own, Sputnik have their own, but Sputnik have it's a little bit different. They did a PCR instead of looking for the symptoms, so they get the 91.8%. So if, as Dr. Jamal mentioned, the Israel have been leading the vaccines movement to vaccinate their populations. So they see a droppage in the number of cases and also hospital admission, especially those above 60. However, this is very early data that we can comment that much. But of course, yes, as mentioned, Prof. Jamal, it shows positive effect. However, this is too early to be discussed actually. All right. So we talk about safety. A little bit on safety. There's no 100% safe drug in the market. There's no. Right. We must always outweigh the risk and benefit for every drugs. And of course, in this case, the vaccines. I put on the upper part the efficacy, and we're going to talk a little bit on two studies that we have in mRNA vaccines. The first, the Pfizer BioNTech, which have 43,000 participants. Within this 43,000, there's 21 adverse event. Adverse event is put into systemic and local. Systemic, like you have fever, you have chills, you have myalgia, arthralgia, And the local effect is a pain at the injection site, swelling, redness. Those are the adverse event. So only 0.6% of these people have severe response, adverse event. And from there, if you look at that from the Pfizer-BioNTech study, you see 6 dead and 2 in vaccine group. Both died because of IHD. And in the placebo group, placebo is actually those who actually did not receive the drugs, but replacement of the drug like normal saline or anything else, which is not the drug. And 2 is actually unknown. The other 2 have the other one have hemorrhagic stroke, and last have myocardial infarction. So the death is actually not related to the vaccine itself. Okay, if you look at Mrna, Mrna shows us the unsolicited. I mean the side effect that you don't want. There's a side effect that you want actually when you give the patient the vaccine. You are expect to have pain. You are expect to have redness. You are expect to have the response from the vaccine itself. That shows that actually you are making antibody. That is actually a positive response. That is what we call the solicited adverse event. The unsolicited adverse event is those who you don't want. Suddenly you got anaphylactic reaction, for example, or you got a Bell's palsy as example. So those are actually unsolicited adverse event. After the second dose, you're going to see vaccine related is 21.9%, similar to Pfizer-BioNTech, and the severe event is 0.5. If you look into the death in Mrna study, you're going to see vaccines group have two participants that died from the vaccine group. One is because of cardiopulmonary arrest. The second one is because of patient suicide. In the placebo group, there's 3 of them: intra-abdominal perforation, cardiopulmonary arrest, and also SID because of the lymphoma. All right, we're going to talk a little bit more on the side effect that is being brought by the community recently, anaphylactic in COVID-19 vaccination. Right, COVID-19 related vaccine actually varies, but I'm going to take the highest most. It's actually the Pfizer-BioNTech, 11 people in 1 million. And then we need to compare this to the global incident. Because why? Because we are actually vaccinating a lot of people at one time. The concentration is high. So if you look at the global incident, it's 1 to 761 per 100,000, which is, if we look into the vaccine related, it is way lesser than the global incident. And if you look at the medication that we use, example penicillin, we have 1 to 5 allergic cases per 10,000 cases. I didn't get the anaphylactic rate for penicillin, but it was for allergic, it was 1 to 5 for every 10,000, which is way more higher than the vaccine itself. Of course, this is diluted over time. And if you look at vaccine related, if you divide it to 10,000, it is going to be 0.001%, something like that. Yeah. So what is the long-term side effect? This is the most common debatable thing. We did not know the long-term side effect. We did not know just yet because the vaccine is new. Number 2, FDA have reviewed previously the previous drugs, the previous vaccine, and they noted most of the side effects occur within the first 2 months after the vaccine being given. Therefore, the regulation today is actually ask all the manufacturer to observe for at least 2 months before release the result. But the review will be done, and the review will be done after 2 years to look for the long-term side effect. So at the moment, we can only say that we have very limited knowledge on the long-term side effect. However, the short-term side effects are well documented. So we talk a little bit on COVID-19 variants. Nowadays, we have 3 variants. The one that is well documented is the UK variant. Number 2 is the Brazilian variant. And number 3 is the South African variant. If you can see that recently, we had a few issues regarding South African variant is not responding to the vaccine, especially AstraZeneca Oxford vaccine. That's why we have a lot of other types of vaccine, the need to have multiple types of vaccine, because one variant might not work in one vaccine and may work with other vaccines. What I can say with RNA vaccines, this is theoretically Of course, it's not being shown by the data yet. As long as the mutation is not happening at the spike protein, theoretically the vaccine should work, theoretically, right? So if we have the data later on, then we can comment on the efficacy of the vaccine for other variant as well. So that's all from me. I guess it's too short for 20 minutes to tell you guys all about the vaccine and also all about the vaccine, especially we have a lot of other types of vaccine. But yes, true enough, Prof. Jamal have said the data is there. You can read. Every single paper is available for you. And I hope you can do your own research and respond accordingly. You just need to remember that our decision to take vaccines and then not to take vaccine is not only affecting us, it will affect the community. So with that, Dr. Abdul, thank you.
Thank you very much, Dr. Muhammad Safwan, for your insightful and rich discussions. Well, I think, yeah, both speakers, Prof. Jamal and Dr. Safwan, have shared it with us. Very huge information and also data that need to be read again and again. And I think, yeah, this is what we wanted. Earlier, there were some suggestions that maybe we start with Dr. Safwan, but I got a suggestion from some of the participants that maybe we start with a public concern. That's why I started with Prof. Jamaluddin. Otherwise, the initial plan was to start with Dr. Safwan, but I think the two speeches has complemented each other. Now it's time for us to move to the third speaker. That is Professor Dr. Ahmed Mabrouk. Dr. Ahmed Mabrouk is a scientist, an author of Islamic law and Islamic philosophy of science. He received his PhD degree in electrical computer engineering at Boston University in 1998. His PhD dissertational work was won the first place award for the most innovative research work in Boston University in 1997. Over the past 30 years, Prof. Mabrouk has worked for industry and academia in various technical and managerial capacities across the 3 continents. Prof. Mabrouk also combined practical engineering expertise to Islamic studies of fiqh and usul al-fiqh as well. He has been teaching practical-oriented fiqh topics for 37 years. In 2016, Prof. Mabrouk has published Islamic Worship, Fundamentals and Applications, a practical guide with hundreds of real-life cases, which capitalizes on the teaching experience of the author and numerous legal issues he encountered as well. So Prof. Ahmed Mabrouk is currently, the COO and the founder of Skillic Robo Advisory. And we would like him to speak about, well, now we have seen the public concerns and also we have seen the scientific concerns of the vaccination. I think both Prof. Jamal and Dr. Muhammad Safwan have beautifully and nicely explained it. But what left is actually religiously and ethically, there are some concerns, there are some issues. Number one, there are some people who are saying, well, the ultimate healer is Allah subhanahu wa ta'ala, as mentioned in the Quran. Therefore, there are some people who are there in the public who are actually making some kind of concerns that why do we need to vaccinate the public? Why? Because after all, it's Allah subhanahu wa ta'ala who will give the healing. Ash-Shafi hu Allah. So why do we need to rush, and go to vaccinations? So the question here is, does vaccinations contradict with the teachings of Islam? So this is one of the questions that is being raised actually, and we would like to listen from Professor Mabrouk. And then number 2, another concern that is made is actually, are the contents of COVID-19 all halal, as we have seen just now, or actually there are non-halal sources? included in the vaccination content. Another question that is always raised, in the public is, what is the Islamic teaching in the, if let us say the contents of the vaccination, some of it is from non-halal sources? Should we focus on the non-halal sources and therefore haramize, or prohibit the vaccination because it has a non-halal, content? Or when there is a when there is a conflict in the case where there is a vaccination which is from non-halal source, can we say, well, now the priority is life-saving? That is in the case, I'm saying in the case where the vaccination is from non-halal source. Should we prioritize life-saving over those issues? So what is, what are the Islamic requirements for acceptable vaccines actually in terms of content and in terms of safety as well? So, well, I think to get clarification on these matters, we would like to invite Professor Ahmed Mabrouk to shed the light on these matters and share his thoughts and, discussions. Prof. Ahmed, the floor is yours.
طيب الحمد لله والصلاة والسلام على رسول الله صلى الله عليه وعلى آله وصحبه وسلم. رب اشرح لي صدري ويسر لي أمري واحلل عقدة من لساني يفقه قولي. So, do you hear my voice?
Yep.
Okay, طيب good, alhamdulillah. So thank you, Dr. Abdul for your nice introduction. Actually, I listened to Professor Jamal and to Dr. Safwan, and I myself learned a lot from their nice technical introduction. Now it is time to shift to a different angle, because when we deal with such problematic situation like the pandemic of COVID-19, there are many factors that affect our behavior, like our lifestyle. But of course, religion is one of the most important things that affect how we react to this uncommon situation. And as Dr. Abdul said, some people will ask, why do I need to put myself to the hazards of unknown vaccine? Why don't I just leave things to Allah subhanahu wa ta'ala? So inshallah, in 10-15 minutes, we'd like to touch on these issues from the Islamic point of view. So these are the topics we are going to go over. First of all, we'll just take 1 or 2 minutes about the history of vaccinations. Then we'll talk about the concept of tawakkul in Islam, which is one of the most important points that people want to clarify. And of course, the concept of tawakkul is based on some of the statements of our Prophet ﷺ. So we'll look into the most important ones. And we'll also look at the origin of quarantine in Islam. And then we'll handle the question of purity, as Dr. Abdul mentioned, whether there is some najis filth in the vaccine or not. And then we'll come to the final decision, which is, should I take the vaccine or not by the end? But I just warn you, so you don't raise your hope high. The situation is more complex, and it is not straightforward to say yes or no. That's why I think some of you, when you answered the survey, many of you said unsure. So I would like to go into that, but inshallah, hopefully the talk will shape our thoughts within the Islamic framework. So first of all, the idea of vaccination is one of the most brilliant and perhaps innovative idea in the history of mankind. And the reason for that is clear, because actually the virus is a source of harm. So to get to the point that you attenuate it such that it gives you immunity is a very nice idea, actually. And Ibn Sina, who passed away in the early 5th Hijri century, noticed that in his famous book, Al-Qanun fi al-Tibb. He said that some people, when they take some types of toxins, if they take it first with very small amount and then they increase that amount, after some time they get used to it and it doesn't affect them. And this is basically the idea of vaccination, that you take a little, of course, don't try to use that. This is just for some type of toxins or poisons. Don't use it at all. This is just observation to show us how Ibn Sina noticed this idea of raising the immunity through taking a small amount of something. Then smallpox, which you see this photo for it, but smallpox actually can be much more severe than this, which is something most of our kids get. Most of the vaccination in the early stages were against smallpox. So what they used to do is to take some of the blisters and to put it here. You see this area in the palm, and to make like a scratch in this area of the palm and put the blisters in it. And amazingly enough, it used to have big effect. And actually it eradicate smallpox from many areas in the Muslim countries. And the Ottoman Empire, which is Turkey, was actually practicing the vaccination against smallpox on a wide scale. Actually, it was narrated in 1717, almost how many centuries now? Like 4 centuries almost. There was a British woman living in Istanbul, and she sent a letter to actually the government of UK, telling them that in Turkey they apply actually the vaccination against smallpox on a wide scale, and it is very successful and it didn't cause any issue. So when the king of Britain tried to apply the vaccine, interestingly, and perhaps it was a surprise, can you expect who opposed the vaccine? Actually, the people who opposed the vaccine was the church. The Church of England opposed the vaccine very severely, and they looked at it as a way for fighting the will of God, the will of Allah subhanahu wa ta'ala. So this is how the Christian world reacted to vaccine. Now let's see how the Islamic position, or what the Islamic position is. Actually, when we talk about tawakkul, tawakkul actually is a midway or a midpoint between two extremes. One extreme, which you see to the left, is this one, which is to believe in means or the asbab or the wasa'il as the real doers. And this is basically what the disbelievers believe in, that they think that it is the virus that carry the thing, and it is all like autonomous reaction between the virus and your body. So this is one extreme that doesn't actually belong to any religion, not just Islam. The other extreme, which unfortunately some Muslims nowadays lean toward it, is to say, if Allah subhanahu wa ta'ala is the owner and the controller of everything, I should just act passively. I should live my life the normal way without paying attention to it. And since it is in the hand of Allah subhanahu wa ta'ala, whatever He destined, it will happen anyway. Neither of these position is the correct one, and is what Islam is asking us to do. What Islam is asking us to do is to believe in the will of Allah subhanahu wa ta'ala 100%. As Professor Jamal said, the hope is in Allah subhanahu wa ta'ala. It is not in anyone else. However, it is in the hand of Allah subhanahu wa ta'ala to make that vaccine work or to stop it from working completely. And we have a responsibility to take, and we are ordered to take actions and to apply the means in order to prevent that. So to see that in more practical context, you have to realize the vaccine, even though it may come to your body, it does not necessarily attack. And I just mentioned an example here. You know polio. Polio can come to many of us. When we test 1,000 carriers, please note that we are not talking about people who didn't get the virus. When we say 1,000 carriers, mean those are the ones, if you test their saliva, you will find it in it. Out of these 1,000 carriers, only one will experience the severe impact of the polio virus. So when the virus comes to our mind, there are three possible scenarios. The first one, that the virus may attack. And if the virus attacks, your immunity system will respond. And your liver will send its soldiers to defend against the attack of the virus. And based on this battle between the liver, or between the immunity system led by the liver and the virus, you may feel some fever. So the fever is actually the side effect of this battle taking place between your body and the virus. But there is another scenario, which is the virus may be weak and your immunity system will prevail. And in such a case, you are basically lucky, because that will boost your immunity. And the third scenario, which happens actually to many people, the virus may just stay inactive. It doesn't do anything. So actually, when you look at these three scenarios, it affirms in your mind that it is Allah subhanahu wa ta'ala who makes the virus work, and it may work in a negative way on us, or it may work in a positive way on us, which is elevating our immunity, which is basically what the vaccine is trying to do, or you may not even feel it at all. When you understand the meaning of probability, you will understand how Allah subhanahu wa ta'ala runs the universe. It is not just the immunity system. The immunity system, yes, it does have an impact, but actually we don't fully know what affects our immunities. Like we have seen many very strong people dying out of corona. And also we have seen very old, weak people surviving corona, even though you may think that the immunity system of the older is weaker. But subhanallah, the factors that affect the immunity are not well known to us so far. So this is the concept of tawakkul on Allah subhanahu wa ta'ala, that you know that the fact that your body attracted the virus does not necessarily mean it may work or it may not work. Now, when we look at what our Prophet alayhi salatu wasalam said, we have two fundamental hadith. Number one, the Prophet alayhi salatu wasalam said, لا عدوى ولا طيرة ولا هامة ولا صفر وفر من المجذوم كما تفر من الأسد. What does that mean? First of all, before I translate the hadith, I want you to know that the Prophet ﷺ was responding to a situation in the Jahiliyyah, where people used to think that if a sick person or a sick camel, actually this situation used to happen, the infectious situation used to happen a lot between the camels, because that was the commonly existent animal at that time. So the Prophet ﷺ negated that, and he said no infection, meaning it is not the agent that caused the action. What caused the action, it is Allah subhanahu wa ta'ala. But then, and pay attention to this is the beauty of the hadith. First of all, the Prophet ﷺ attributed the whole impact to Allah subhanahu wa ta'ala. But then he said, when you see someone with leprosy actually is the judam, which is a very severe disease, actually, very severe. Run from him the same way you run from a lion. And one day, some people came to the Prophet to give him bay'ah. One of them actually had that disease. The Prophet ﷺ called and he said, "Irja' fa inna qad bay'anak," meaning go back. We have given you our bay'ah, meaning that the Prophet ﷺ didn't want to interact closely with him. Now this is the action, this is the asbab we have to take. So that hadith actually is very beautiful, because it gathers both. It gathers the belief on Allah subhanahu wa ta'ala, as it talks and addresses the action we should take. These are the precautionary measures we should take on our side. And then there is a hadith which says, as you can see, both hadiths are in Bukhari, and the second hadith is in Bukhari and Muslim. So those hadith are very authentic, very authentic, very strong hadith. The Prophet ﷺ said, لا يورد ممرض على مصح. The meaning of the hadith, if you have sick camels, don't let them be in touch with the healthy ones. Why? Because the sick ones may act as asbab, Allah subhanahu wa ta'ala may associate the transfer of the disease from these camels to the healthy one if they get in close contact with each other. Imam al-Nawawi radiallahu anhu, and of course Imam al-Nawawi, especially in Malaysia, we all know him because he is the one who authored the 40 hadith. I think most of us studied the 40 hadith by Imam al-Nawawi. Imam al-Nawawi commented very cleverly and in a very compact statement. He said the first hadith negated that sick people are contagious on their own. It is Allah subhanahu wa ta'ala who caused the impact. But without denying that they could be harmful to other people by the will of Allah subhanahu wa ta'ala. And the second hadith, which is don't let the sick camels get in touch with the healthy one, guide people to avoid actions that are usually associated with harm. So if medicine tells us this usually causes a harm, it is our responsibility to avoid it. So in short, we should believe in the will of Allah subhanahu wa ta'ala, but we have a part and we have a responsibility that we should seek the good and we should avoid the evil. Now there is a third hadith which actually not about the vaccine in particular, but it talks about the origin of quarantine in Islam, where the Prophet alayhi salatu wasalam talk about the Black Plague. You know, the Black Plague actually killed millions of people in Europe, especially at the time that the hygiene and the public cleanliness was low. So the Prophet ﷺ said, when you hear that this infectious disease is in a land, don't enter. Pay attention. If you hear that the Black Plague is in a land, don't enter this land. And if it spreads in an area you live in, don't leave this area. I think now when you heard this hadith, it immediately came to your mind the prohibition of interstate travel in Malaysia. Yes, actually it is a straightforward application of this hadith. That if there is a cluster in an area, if you hear about that cluster and you are outside, don't enter. Don't intermix with these people. But if you are inside this cluster, don't get out. So some people may ask, why don't I get out if I'm still healthy? I think this question may also come to your mind. The reason is, any virus, when it comes to your body, it gets a custody inside your body for a few days. Like, for example, the common cold, they take 1 or 2 days in custody inside your body. For COVID-19, it takes 4 to 5 days. And I think this is one of the problems of fighting this disease, because it may stay in your body. You are not aware of any change, but you are still spreading. So because of this possibility that you may get the virus, but it is inactive on you, don't go out so you don't spread it to other people. So actually there are several hadith other than this that talk about this issue, but these 3 ones are very direct to our situation. The first hadith in particular, this one, handles the concept of tawakkul. It talks that, yes, there is no infection. It is all in the will by the will of Allah subhanahu wa ta'ala. But also it tells you, you have a responsibility. If medicine, if the accepted knowledge at your time is telling you that there is a harm associated with this situation, avoid the situation. If you see infection person, run from it. The Prophet telling you, run as if you are running from a lion. Yani escape with your life. Don't wait. And the hadith about the quarantine is also very important, because that's what we apply. The SOP in Malaysia is basically an application, is basically elaboration on this hadith. Then we come to the question of purity. The first point I want to mention, the purity, as Dr. Safwan mentioned, there are different types of vaccines, and everyone is developed in a different way. So I cannot tell you whether the vaccine has impurity or najis in it or not. We should insist we know that from the developer or the manufacturer, basically from the developer. They should tell us whether the vaccine has filth in it or not. But I will answer assuming that there is a filth in the vaccine, even though we have to confirm that with the developer himself. So first of all, we have to understand what are the cases where the purity is a concern. Number one, purity is a concern if the thing is attached to outside the body. Like, for example, at a certain point of time, I'm not sure if it still exists or not, when they make the stitches, you know, if you get a wound and the doctor stitches that, sometimes they used to get the stitched thread from the internal organs of the cat. And this, according to the Shafi'i school, is filth. But I'm not sure if they're still going with this or not. But at a certain point, yes. And I think 6 years ago, I made a small surgery and I asked the doctor, is this from the internal organs of the cat? He said, no, this is not from the cat. They stopped that. But if you carry a filth in your teeth or in a stitches in your body, this may be a concern because it may affect your purity regarding prayer. Also, if the thing is taken through the digestive system and it has alcohol in it, this is a concern because Allah subhanahu wa ta'ala prohibited us from consuming wine, and the main ingredient in wine is alcohol. But the vaccine is neither under any of these cases. The vaccine goes inside the body. So it doesn't go to your stomach and it doesn't stay at the outside, the external part of the body. So it is less of a concern. The second point is we should also consider the impact of the disease. COVID-19, even though the death rate is not too high, but it is not an easy sickness. Even if you recover from it, some side long-term effect may appear later. And the impact of the disease is not just limited to you. It also affects the people around you. And interestingly, it affected the most close people to you. It will affect your wife and your kids the first. So assuming that the developer had no alternative and that the purity is not affecting the external part of the body nor the digestive system, I would say that the issue of impurity is irrelevant here. It doesn't affect us much because it doesn't affect your prayer. It is not something you ate, so you cannot treat it as wine. And also the severe impact of the disease has to be taken into consideration. And again, I also mentioned that we should inquire directly from the developer about this. Now, we come to the important question. Should I take the vaccine? Actually, there is a good fatwa by the Assembly of Muslim Jurists of America, and I put the link for you here. I advise actually all of you to read this fatwa. It is very nice and it handles and addresses many of the questions you have in your mind. So I quoted some of the important points from this fatwa and put it for you here. Number one, if you look at this second point, it says there is no blame on physicians or researcher when they based their judgment on the greater likelihood. And Imam al-Mardawi, by the way, Imam al-Mardawi is a Hanbali scholar. This is different from Imam al-Mawardi, the Shafi'i scholar. Pay attention to different name, Mardawi and Mawardi. Al-Mardawi, this is the one we are talking about here. He said, where we accept the judgment of the physician, it is based on the greater likelihood. What does that mean? It means no vaccine is 100% effective. When we say, for example, this vaccine is 90% effective, what does that mean, 90%? It means 10% of the people who get this vaccine may still get sick with COVID-19. However, the ruling, the Sharia stand will be attached to or will be based on the higher likelihood. And the higher likelihood here is in the side of taking the vaccine. But someone may say the vaccine may have some side effects, and some of the side effects are severe. What I gathered from Dr. Safwan, he said the side effect, the severe side effect is about 1%. Let's assume 1%. It is less than this. He said 0.6%. Let's assume it is 1%. So there are some side effects, and also the death rate is not too high. So how we deal with this situation? Notice here, this is the last point here. As for the suggested risks of the vaccine, it must be stressed that, pay attention here, the Fatwa Committee is not the entity that should opine on this matter. What does that mean here? It means it is the conflict between masalih and the mafasid. It is the conflict between the good positive sides of the vaccine and the negative side effects of it. So who should decide on that? Religion just put the framework. It tells you, see which one outweigh the other. If the goods outweigh the negative, go with it. If the negative outweigh the positive, go with it. So this is a question actually to the medical doctors. And when the medical doctors talk, they also talk aided with the statistics. And I think that's what Dr. Safwan did. He showed to us that there are some side effects, but the rate of it is not too high. So actually in this fatwa, when you read it carefully, and I advise all of you to read it, just 2 pages, but it will really address many of the issues we talked about. He said that we are more inclined to say it is obligatory to take that vaccine because its impact is not limited to the taker. It also affects the other people around you. So I know I may have not given you the clear answer you are looking for, but this is because actually it is a mixed situation. It is a conflict between some good expected stuff and some negative stuff that may happen or it may not happen. But apparently, and based on the statistics, and based on the impact and the widespread, especially the second wave of the vaccine, it is more on the side of take it because of the death rate and the impact you may have on the close people around you in the same house. So I hope I answered the important questions. And if there are more sticky issues, inshallah, in the question and answer session, we can discuss them. أقول قولي هذا وأستغفر الله لي ولكم والسلام عليكم ورحمة الله.
Thank you very much, Prof. Mabruk, for your insightful discussions. I think you touched the topics that we wanted to touch, and you related to the prophetic hadith and the Islamic teachings as well. Well, now we have listened to the 3 speakers, our panelists. Each of them give us insightful discussions on the topic. from the scientific perspective, from public health perspective, and also from religious and fiqh perspective as well. But that doesn't mean all the question has been answered. I think there are, the more we listen to the presentations, the more we know about the topic as taught and shared with us by our speakers, the more we raise questions and we become eager to know more about our panelists and our expertise here. So, well, I think there are some questions raised in the chat. Some of you mentioned it. I think Prof. Jamal, Dr. Safwan, I think Dr. Mabruk also. You look at the chat, there are some questions raised, and I think there are some questions that are also coming. As I said, the more we listen to you, the more we have questions as well, because we are all eager and interested to know about you, about this, from you about this topic. But before I give the public, the chance, I would like to raise one question to each to start the Q&A. Now I become more like a selfish, as a moderator, I want to raise some questions, which I actually received from the public as well. So for Prof. Jamal, I would like to start with the question that there are some, I don't know, some kind of public concern. Some of them look very wild, actually, conspiracy theories flying here and left, in the social media about the vaccinations. Some of them look, well, I don't know how to explain it. They look like they are having a lot of doubt about the vaccinations, especially some of them are mentioning that there are some hidden agenda about the vaccinations, because they mentioned that the whole virus was actually, according to, I don't know, according to them, maybe Dr. Safwan can answer, is a man-made and artificially designed virus. And now when the virus is spread, there are some people who want to benefit from it economically, or maybe want to apply their theory, and therefore they are offering these vaccinations because people are now panicked and they are looking for anything for safety. So some of them are saying that there are some theories that are anti-population, you see there, and their agenda is to get the public vaccinated, and once these vaccinations are completed, it's actually having a hidden agenda of mass contraception, whereby, especially for female or women of reproductive age, would not be able to reproduce in the future once they get this vaccination. I don't know how to put it, because I have seen so many comments, and some of the public and the participants email me, WhatsApp me just now. So are there hidden agenda actually behind the vaccinations, whereby the women of reproductive will be khalas, finished, no more reproduction? Is it true scientifically? That's one of the concerns. And number two, for Prof. Jamal, one more question for you is, who should get first actually? Because this is one of the common concerns. Who should get first? The frontliners, of course, we understand. Then who else? The politicians, academicians, researchers, economists, the rich, the poor? I don't know. What would be the criteria actually to distribute the vaccinations once it's arrived, here? So these are two questions for Prof. Jamal. Should I proceed the question for Prof. Safwan? I finish one time and then I give you the chance.
Let me answer first, Dr.
Okay then, please.
Thank you for the questions. With regard to conspiracy, one, I would like to say, personally, definitely, I do not know whether the conspiracy is true or not. The title, the term also used conspiracy. I do not know whether it's true or not. So it depends on what they are saying. Okay, but if you are saying that the conspiracy with regard to reduce fertility of women, for your information, without any vaccine, without any special drug, the fertility rate all over the world is reducing. Without you giving any special drug, we do not need all those drugs anymore. The fertility is reduced all over the world. You see, it is not because of the drugs. It's not because of electricity, of the 5G people are saying. No, it's because of human being. So now we have those days during our parents' era, the men's going out for work, women stay inside. So when the men come home, women will welcome the husband. They have a lot of time, family, husband and wife time. But now both are working outside, both coming home tired, and now you're asking about Come on, man. Look, real perspective. It is not drugs. We don't have to invent any special drug to reduce fertility of the humankind. Unless they are upset with the film Thanos, apa yang they snap the fingers and then half of the population gone. Things like that. No. So you do not need drugs for that. We are seeing, for example, if you study demography, for example, you look at people in Japan, for example, their life expectancy is very high, but their fertility rate is very low. Because why? People don't really bother about the progeny anymore. Producing for them, one is enough, two is enough. Those kind of those are. I don't think there is. If you want to you want to conspire, you want to have a that plan, global plan, you must be very genius. Must be somebody that control every single thing, every lab. Oh, that is very tough to be done. So personally, I don't believe there's a conspiracy. I told already that we know the virus for a very long time, and then the current situation is that suddenly the funding coming in for us to do all those research. Without the backup of the why okay now if I were to say something about conspiracy, I'm not talking about conspiracy, I'm talking about business oriented. So because of the potential of selling this drug, of course I invest my money. I invest, and then even though we are selling these vaccines very cheap, less than $10 per vaccine, so very cheap. But then volume, people will get. So this company eventually become rich, yes. But in terms of they're going to destroy or try to make us non-fertile, I don't think so. I don't really.
Okay, good. What about the second question, bro?
The next question is?
The second question, who should get first?
I think this one, Safwan should know better than me, but definitely the frontliners will get first. And after that, we're going to focus those who are high risk to get severe disease, like those with high morbidity. Then after that, they will go into the public. So how they will do this for Malaysia, for example, it depends on stages, I believe. Now, our main concern is the first stage. Malaysia is at the moment preparing a few millions, 26 million, 30 million Malaysian ringgit. At that particular amount of money, we are able to only cover down more than 30%, slightly more, 30%, I believe, of the population. So we are yet to cover enough to achieve some sort of immunity level for the populations. So we go stage by stage first. For the time being, I believe the policy is the frontliners first. Even the frontliners, I don't believe is enough, I can tell you, because there are different frontliners. The health frontliners, and then the essential service health frontliners, there are different category of frontliners. And after that, they will focus on definitely at the those with high risk. Meaning to say that if you got COVID, you have higher risk to die or to get severe diseases. And after that, they will go to the mass. I think if Dr. Safwan knows more than that, you can add in, Safwan.
No, actually, that's about it, Projaman. That's about it. The three phase that our vaccination COVID-19 vaccination program is actually whatever Projaman have said before.
Right.
Yeah.
Okay, thank you. For now, I think my question is also direct. One question that I'd like to begin with, Dr. Safwan, is, which I also received it by WhatsApp, is actually the question about, well, does the vaccinations that we have now deal with the variations of COVID-19? We know COVID-19 virus now has, somehow variated, there are variations here and there. So some people are concerned that actually these vaccine, if I take the vaccine now, the 2 doses or 1 dose, is it going to, how do I say, cover the all variations, or is only one? And then I need another vaccination for each variation. So perhaps you can share with us that point. Yeah.
All right, and that is the data that we don't have. We don't have that much of data. There we know that if we talk about whatever we have now, we have the 3 variation I told before. One of it is the South African variation that shows a little bit less efficacy in some of the vaccine, but it does not show less efficacy in the other part of the vaccine. So to answer your question about do I need another vaccine for the variation, I have no answer for that actually.
I see. I see. Okay. Then very good. For Prof. Mabruk, I think one of the coming question that is always raised about the vaccination is, what is the Islamic requirement for acceptable vaccine in terms of safety and in terms of the content? What are the rules that Islam sets, for vaccinations to take place? Is there any specific rule, or is just a general teaching?
Well, actually, yes, as you as you expected, that there is a general framework, but there is no hard rules. It is all the vaccines we all know. Actually, when the vaccines started in Europe, one of the things that turned people against it, it was not attenuated enough, so it caused some side effects. So the fact that the vaccine, actually any shot, has some side effect is there. This is no one can deny. Actually, one time when I was living in Canada, my doctor told me, I'm not a medical doctor, my doctor told me any shot, even when you get injected by vitamin, may have some side effects. But the issue is the rate. How much, how often this bad effect happens. Even when pregnant people take an X-ray, there is a possibility that the X-ray may cause some distortion to the fetus. We all know that. And by the way, before you make the X-ray, you sign something that you acknowledge this. But most of us don't read this paper. So the fact that the vaccines have some side effects is undeniable. But the fact that the vaccine has managed to have very big favors on mankind is also undeniable. Many diseases have been eradicated, and some of these diseases was extremely devastating. So the big impact of the vaccine is well known.
Okay.
The side effect of the vaccine is also there, we cannot deny it. So what is the threshold? You want a number, for example, you tell me if it is more than this percentage, say okay. If it is less than this percentage, say no. Unfortunately, this threshold is our own judgment.
Okay.
And it varies with many factors. Like the death rate, like the impact, like the spread factor, all these things. And the spread factor, as you know, differ from a region to a region. It seems based on the weather. So unfortunately, there is a framework, but there isn't any hard rule we can give such that you can apply the formula and you come up with a number saying yes or no.
Okay, thank you very much, Prof. Thank you very much. Okay, now I think I will open, the questions of the floor to the participant. And there are some questions which are already being mentioned in the chat. So perhaps while the public is coming in, the participants are coming in, maybe those names whose names are mentioned, those panelists whose names are mentioned for answering certain questions, perhaps can start. Especially Prof. Jamal, I think there is a question for you there, I can see.
Okay, from Akmal. So
yes.
Some discourses in the virtual platform mention an alternative approach to respond to COVID is to increase immune system. How to statement? What are the proper ways to do that if it helps? Thank you. Okay. Increasing immune. Maybe there are now people who are selling vitamin C injection so that they will increase immune system. I will not going to answer straight yes. The answer is yes and no. If you ask me, how should we maintain our immune system is important. If we are good in optimal immune system, if there is any disease, not only for COVID-19, our body are able to produce enough defense system to fight any disease, not only related to COVID-19. That's the general fact. So the answer using that fact is true. So if our immune system is optimum at that particular period when we got any infection, so our body is able to fight. But you must be aware, if I say optimum means the usual one, not something very excessive. You don't have to infuse vitamin C inside your body to increase immunity. Don't have to do that. Enough, for example, you drink a lot of water every day. you take fruits, balanced diet, you exercise. That's enough. So you don't have to do any extreme measures to increase your immunity. Because why? One of the reasons why people die because of COVID-19, because of, you know what cytokine storm, right? What is cytokine storm? Your own body produce excessive immunity, and it will destroy not only the virus, but everything else. So remember, so there's a coin, flip side of it. So, so when I say immunity is good, yes, the usual level of immune system, our healthy, our fitness that we have. If you ask me what should I take, drink a lot of water, take balanced diet, do exercise, don't smoke. So do all those usual healthy lifestyle. Do not need to take injection vitamin C. Those who are recommending that is the one that's selling vitamin C or any herbs. Just take your usual diet just to maintain your lifestyle. That's very important. And one of the important things, if you want to mention about immunity, stress also very important. So make sure you know how to cope stress, working stress, being confined in the house stress. So those also part of immunity as well. So that's my quick answer, Dr. Razak.
Oh, thank you very much, Prof. Thank you very much. Is there any other comment before I move to Dr. Safwan? Dr. Safwan, maybe you want to share with something?
Yeah, there's two questions I think I will answer.
Dr. Akmal, is that okay, Dr. Akmal? My answer?
Yes, Prof. Safwan.
Yeah, I think there's two questions that I would like to answer. The first one from Yazmi. Is there any side effect or proven safety for those who are allergic? There is actually for those who are allergic, actually vaccine are for everyone more than 18 years old, except for those who actually have a history of anaphylaxis. Allergic have a what we call this a mild form and the severe form. The severe form we call it the anaphylaxis reaction. So if you have previously anaphylactic reaction, you are not supposed to get the vaccines. Number two is those who are actually to have anaphylaxis or allergic to the first vaccine. You get the first dose of vaccine and then you develop the anaphylactic reaction or even allergic reaction. You are not supposed to take the second dose. Number three and number four is actually those who are lactating and also a pregnant lady. Those who are actually because we don't have enough data just yet. So if you have allergic, we will discuss with you. Most of the time we will have our pusat pemberian vaksin. In our PPV, pusat pemberian vaccines, we will prepare areas to observe those who will develop allergic for 15 to 30 minutes. Let's say after 30 minutes you don't have any reaction, there will be no reaction, and then you will be let go to continue your daily activity. So there will be observational period for those who are actually, for everyone actually, but our main concern is to tackle those who are with allergies. Number two is actually how safe is those to the heart patient. It's quite safe. The similar safety profile that we have to other people is the same applied to any people with heart disease or diabetic hypertension. It's the same safety profile. In fact, I would recommend those who actually with underlying illness like diabetes, hypertension, congenital heart disease to take the vaccine, because these are the vulnerable group to get severe form of the COVID-19. I hope they answer the question.
Okay, thank you very much. I think there is a question also for Prof. Ahmed. Thank you very much for your great input for all panelists. My question is to Dr. Ahmed. Somebody asked, I think that's Noor Sida. She said that, Prof, while the frontliners and health experts are fighting the pandemic in the medical sector, is it? And in the community, we have non-health expertise openly writing to influence people to oppose the expert input. What is the hukum for this act? I think this question is for Prof. Ahmed. They are non-expert, yet promoting their ideas and cause more hurdle for frontliners. I think this is a valid question, which we always see in this kind of behavior in the social media. Some people who are making all kind of conspiracy and wild ideas which are not scientific. So what should we do with this?
Well, actually, the concept of specialty has been established the first time by our Prophet alayhi salatu wassalam. You know that the Prophet ﷺ was accompanied by his Sahaba, his companions. These companions, their knowledge and the focus were different. So the Prophet guided us, or guided the people around him, which one to ask about which thing. So for example, he said, Ali ibn Abi Talib is the cleverest one when it comes to judgment. So if there is a court issue, ask Ali. And Zayd ibn Thabit is the most knowledgeable one about inheritance issue. So if there is a legacy issue, how to divide the tarika, ask Zayd ibn Thabit. So we should do the same thing exactly. And this is the verse we always recite, فَاسْأَلُوا أَهْلَ الذِّكْرِ إِن كُنتُمْ لَا تَعْلَمُونَ. Sometimes people have psychological tendency to spread unusual things. Like, I am an electronic engineer. So one of the rumors is that this vaccine will put into you some like ZigBee technology that will give the message to the outside people. I know as an electronic engineer, this is impossible, because in order to send wireless communication between your body and the external world, you must have an active energy driven device inside you, and this cannot be part of the vaccine. So some of the stuff is totally baseless, has no base at all. And we should always practice what the Prophet ﷺ said. Seek a knowledgeable person. What he says is the valuable thing you should stick to. Don't just keep talking to people and whatever friend you see in the corridor, in the food court around you, you just keep talking and asking question. This is not good. You will just distress yourself, number one, and get so many different opinions, number two, which will distract you and you don't know what to do. Just seek knowledgeable person specialized in this area, ask him, and that's it.
Okay, thank you very much, Prof. I think, Prof. Jamal, there is another question for you.
Yeah, how I pronounce your name?
Tahrawi, I think
So he asked.
Tahrawi Ramadan.
Yes, Tahrawi. Yes.
Sorry for not able to pronounce correctly. Malaysian authorities so far never mentioned the expatriate community with regard to the roadmap for vaccination. So it's very obvious. Early January, for example, Khairi Jamaluddin mentioned, Representative Mosti, that we should focus on our foreign workers, because they are the one that been transmitting the disease. Of which, for me, is very rational and very good idea that we also immunize the foreign workers. With regard to expatriate, so now, but then the Prime Minister announced that for Malaysian it will be free. So if I take just these two remarks, because there is no, yes, you are right, there is no clear roadmap, because government will not going to say yes, not going to say no at the moment. Saying yes means they have to commit in terms of financial. Saying no, it is not right socially. So being politician, they will keep silent. So, but for me, expatriate is being engaged by or hired by their employer. So I believe at least the responsibility should come to our employer. So if we are in UAE, hopefully the university, Ministry of Higher Education should look all the lecturers, all the staff with regard to the vaccination. We believe it's important. Should look our welfare and our healthcare. So I believe if we are working here in UAE, or then we should not worry. Our employer should look after us, at least for the time being. That is my personal opinion, because yes, I also do not know the clear roadmap with regard to expatriate. That's my my opinion.
Okay, thank you very much, Prof. Jamal. Prof. Dr. Safwan, would you like to comment on that as well? Because I think you are already working in the emergency department and you are involved in the committee, the COVID-19 committee in IAU.
I think that the issue is brought well by Prof. Jamal. I think the main issue for this is actually to get the first line of vaccine. I think the first two is actually the first phase, and the second phase it's quite clear cut, the frontliner and the one with high risk. When it comes into the third phase, there will be more vaccines for that came from the government, and they are going to put the vaccine purchasing by the private as well. So maybe looking towards this roadmap, because we recently, from the recent budget, we also have this what we call the levy. If you vaccine your family, you're going to get some levy from the tax. So I do think that one point that they will allocate to at the phase 3 vaccination program, you can come and buy your own vaccine for your family and get compensation in the thing. So yeah, maybe.
Okay, thank you very much, Professor Safwan. Now I would like to open the discussion, since we already finished the questions mentioned in the chat. Are there any comments and questions and clarifications from the participant? Please feel free. This is your discussion.
Dr. Raza, I received a question from Dr. Yusuf.
Okay, yeah.
Yusuf asked me, actually, with regard to the death rate. For COVID-19, the death rate is very low, less than 1% for Malaysia. If we are looking at death rate, we have 100, 800 over 200 over cases, so it's less than 1%, 0.3. So even if we do all this effort, so eventually the number of people who die is still very low. So as if we don't do anything, also still very low. My question is to the community: if that people who die, even though low, that is your family, are you okay with that? So and then that is based on percent. 1% death rate in 1,000 is different compared to 1% death rate in 30 million people. So you a lot of cases. Percents, for death, you have to look at the actual numbers. So 1%, yeah, quite low, but over 30 million Malaysian, that's a lot.
Yes, that's right.
So we can't simply take the death rate, which is less than 1% in Malaysia lightly. So it can cause death. Seriously, for example, previously when people die from COVID, we do not know who died. But now we start hearing people who die from COVID-19 because people who we know. Recently, my previous lecturer, Dr. Zaina, ophthalmologist, died because of COVID-19. So we start to have cases, death coming from our surroundings. You see, so it's just a little more time before it starts to go into our own family. So don't take death lightly. That's my comment with regard to that one.
And another question, since you mentioned that, another comment that I received in WhatsApp is that, Prof, I do not know this one. I think both Prof. Safwan and Dr. Safwan and Prof. Jamal can comment. We have seen not only death from the COVID-19, but also we have seen there are people who have taken the vaccine, and a number of cases, it happened, a number of cases after they have taken the vaccine, there was death. So what is the comment? Was it as a result of the vaccine or as a result of other sideline or side if, I don't know. This is the question. Even we have seen some nurses, they take the injection and immediately they go they go into coma. So what's your comment, Prof?
I think Dr. Safwan mentioned that clearly just now regarding the ladies, the staff nurse who immediately that is because vasovagal effect, not because of the vaccine. Vasovagal effect. Some people are very traumatic for injections. Not everybody are able to see their body being pricked or injected. And by seeing that, they already become shocked and collapse. And the girl is known to have that one actually. So if you ask me why suddenly you highlight that girl that with that history, because they do not know. So that's with regard to the nurse. And the nurse didn't die. Just collapsed.
Yes, that's right. Just collapsed, yes.
With regard to side effect, Dr. Safwan highlighted very clearly just now, 6 cases who died, but they died randomly. And then if you look at both groups, there are many deaths with the control group compared to the treatment group actually. And then all the cause of death is not related to COVID-19. And there are few cases died because of heart problems, because of the age, the profile of people that they take into the study is elderly, 40 and above, and so they have this concurrent problem. It is not because contraindicated in COVID-19 vaccination. Yeah, just because Dr. Safwan mentioned that few cases of cardiovascular disease just now died either from the control group or the treatment group doesn't mean that it's contraindicated. No, in fact, we would like to give this high risk person the injection very fast actually. So the death is not due to COVID. There are deaths, but it is quite random and not related to COVID-19. So Safwan can add, I believe.
Please, yeah.
There's one incident that previously brought up to the social media. The Norwegian, 23 of elderly died after get a COVID-19 vaccine. But you need to understand what is the approach in Norwegian government. They vaccine all the frontliner, the elderly, those in the old folks homes. Those are very fragile, right? So when they did, they look back into the data. Actually, Norwegian daily death from all these old folks home are 45 per day. When these 23 people came into the picture, this does not show any surge in the daily death or the death during that duration. So they took that it is not related to the vaccine. It is as the natural whatever that they have before, which is around 40 to 45 deaths per daily. So yeah.
Yeah. Okay. That's good. Any other comment, Dr. Akmal Khuzairi? I saw him there.
Raza, I got one question with regard to from Farouk. Do we have the capability to develop our own vaccine?
Yeah, that's a good question.
I think this is a very good suggestion. In fact, in my last slide, I did not mention clearly. The first thing I mentioned with regard to the policy level, we should start thinking about this. And not only few people are thinking about this, everybody now is thinking. But for COVID-19, the current situation, we are not able to generate current situation. But once what is happening at the moment now, we are start to plan our own vaccine development. So for COVID-19, it's not, we don't really have that time to develop, but government is now thinking seriously to develop our own vaccine. So I would simply agree, this is not even a question, for me this is a good suggestion that we should look this thing seriously. I am even hoping that IUM can spearhead one of the, hopefully, of the...
That's good.
That UM and UM is spearheading. I hope
that's very good.
That's all from me with regard to that question.
Yeah. Okay. Dr. Akmal Khuzairi, I saw him somewhere. Are you ready to comment?
I asked my question already to Prof. Jamal just now. He answered, alhamdulillah.
Oh, okay. Okay, great. Any other comments, Dr. Safwan, Dr. Farouk? I mean, Prof. Mabruk, would you like to add some more? I think we are moving towards the end of the program. Very hard discussion. So
I just saw a comment. I'm not sure if it's still the one asking is concerned about it or not, but it's saying that it is important to distinguish between what is real and what is rumors. Yes, that's a very valid point. Unfortunately, in the era of internet and communication, you get overwhelmed with a flood of messages. And it's coming from different people with different agenda, with different mindset. So as Islam taught us, always stick with the people who know and limit your information to them. So actually, this webinar is one channel for establishing that. Also, I'm asking Professor Jamal or Dr. Safwan, is there like a hotline for answering the concerns? Like, even if the answer is I don't know, it is still useful. Like when Dr. Safwan told us about these variants, these 4,000 variants, we don't have enough data about them. That's fine, because it clarifies that the data is not there and it is not analyzed yet. So perhaps it is for Professor Jamal and Dr. Safwan, these people in the medical field, to establish a 24/7 channel, or not necessarily 24, but on a daily basis, that people should have someone trustworthy, reliable to speak to and get the information. Because as Dr. Jamal said, Professor Jamal said, the stress is an important factor. When we get stressed, our immunity system goes down. So one way for reducing the stress is to speak to someone reliable who knows what he is saying. So this is perhaps either a suggestion or a question. Maybe it does exist. Alhamdulillah.
Well, I think let me share this. I mean, Prof. Akmal Khuzairi is centuries, or maybe I am planning to have a center where people can rely for information that is factual about COVID-19 24/7, as Prof. Mabruk suggested.
That is actually the purview of our OCAP, which has been updating about the situations in the university, but not up to the expectation as what Prof. Ahmad Mabruk said just now. Perhaps we should take that one up, inshallah. But then again, when we rely on informations, the tricky thing is that how correct are they? And normally people don't want to take the risk of publicizing things which are not factual. So I think that is always the dilemma, but they're trying their best, inshallah.
But then Prof. Ahmad just now mentioned a very good suggestion. Maybe Safwan, we can consider this as a COVID-19 info center, something like that. Just online. So if you want to post any question, we have experts here. If we do not know the question, we can ask expert outside. So we can get the answer and post online. So then you can get a few FNQ kind of thing. Safwan, we can start thinking about.
That's right.
Yeah, I think this is something is going to alleviate the tension of many people.
Yeah. That's fun. Yes.
It's a very great suggestion. Yeah, it really can alleviate a lot of nervous misunderstanding. But true enough, it needs a lot of commitment, I would say, to be there. And of course, as we are all aware that a lot of us that actually the thing is good. I agree with that thing. But we need to form a group, a bigger group, not just Jamal and me, and some of the because we have our own thing that we need to develop now because vaccine is coming in. We need to plan for the vaccine. I think to vaccinate population, there's a whole lot of another hurdle to go through. So yeah, inshallah.
Inshallah. Okay, I think since somebody asked, I think Brother Taufiq, Taufiq Hidayat, he asked, actually is quite interesting, comment. Does COVID-19 or COVID vaccine has halal certificate?
I think Taufiq mentioned just now, Dr. Taufiq is our pediatrician.
Is it? Taufiq Hidayat, right?
Giving the statement that for COVID-19, especially mRNA, there is nothing not halal about the ingredient based on what we know, because that's purely synthetic. So for mRNA, there is nothing that to say. To say it is not halal. If you are talking about mRNA, it's very clearly that they are. And if you talk about AstraZeneca using a vector, for example, they are using chimpanzee. So even that one is a very small liter and very and if you look at certain mufti, they say that it's negligible in terms of non-halal product in that particular component. Answering about that. So basically, Dr. Taufiq simply clarified that there is no non-halal ingredient in the vaccine. I just want to mention, because just now I asked the question with regard to the concern. So I'm not sure whether you are able to see the result of that survey. So looking at if I want to just share this particular slide only before I give
please. Yes.
The outcome of the survey. So only 23 people responded to the survey. What would be their concern? So you can see most people are worried about the unknown side effect as well as in long-term side effect. As mentioned by Dr. Safwan, we do not have data for long-term side effect. Long-term side effect should be years, 2 years. So of course, COVID is not even 2 years yet. So we do not know the long-term side effect of the vaccine. But as I mentioned, more than 80%, 90% of the vaccine side effect is the short-term side effect, which is happening less than 2 months. That's why FDA for US they put the ballpark figure 60 days for the side effect, and most of all the vaccines that are available pass the FDA. Remember from the earlier slide, Dr. Safwan mentioned there are many candidates for vaccine, many candidates, but not many go through phase 3. So mean to say what? There are many vaccines who fail, but because of their not so good performance, have been filtered from the very beginning. Dr. Safwan mentioned about those who discussed about Pfizer, AstraZeneca, about Moderna. Those are the good ones. But you can see there are many, many more candidates not being able to being developed at phase 2 or phase 3. So it shows that the system works to filter out only the good vaccines to go through the market. That's what happened lah. And of course, the concern is still about the known side effects that has been mentioned clearly by Dr. Safwan. Safety also the same thing. So I hope that the webinar already are able to answer most of the question with the concern. I think that's all from me, Dr.
Prof. Jamal, thank you very much. Since now I think we have been informed by your good team, the panelists, all of you. Should we ask the participant to please participate in that survey for more, input, to get your opinion as well? Surely this will be taken into account. It would be useful to get your opinions, the participant. I think they are all hearing. Please participate in the survey. And I think, Prof. Jamal, we already shared the link, right, in the group.
Yeah,
Yeah, please get that link, share it by Prof. Jamal. And hopefully, since now I think there have been a lot of clarifications, where to some extent, we have been shared, given a good amount of knowledge already.
But I think most of the
perhaps now it's good time for you to comment. I'm looking forward. Well, before yes,
yes. No,
yes,
I think it's already 12:45. It's a long time already.
45 already. Yes, I'm ending now. I'm ending. So, well, with that, before I end, can I give 1 minute to each speaker, 1 minute to each panelist to conclude, and then I will pass to Dr. Akmal to conclude as well, hopefully. Yeah, let me start with Prof. Jamal. Would you like to make a concluding remarks?
Very important that if we do not know anything, if we have any doubt, we should ask someone who knows things. And then, yeah, the main thing with conspiracy theory is still there. People keep on suspecting, but very important to get the ultimate truth. And just like Dr. Ahmad mentioned, very nicely wording, we talk about probability, but there are also probability of side effects and all those things. So COVID-19 is going to be with us for a very, very long time. So a vaccine is one of the measures. So if you are so that we do not know for sure whether it's 100% very good, but vaccines has been shown one of the important public health measures that are able to prevent many infectious diseases before. So we are very lucky now we survive. Many of our great-grandparents suffer from polio and died. So we are the one that, the generation that benefit from the vaccine actually. So consider and ask people who knows about vaccine before you make decision. I also did the same actually. For whatever I told you, I also did the same. I also studied the same. I think that's all from me. Thank you so much. Assalamualaikum.
Thank you very much, Prof. Jamal. Yes, Prof. Safwan, Dr. Safwan.
Right, for me, it's going to be a little bit, I will advocate on vaccines because the data, the knowledge that I have from whatever I had previously. So I will advocate on vaccine because I know the risk and benefit outweigh. Actually, the benefit are more than the risk. Of course, there is. If you take a paracetamol, there is a risk. There is a risk of liver failure. If you took it in a large amount, you can get liver failure. Right? Even you can have anaphylactic if you take paracetamol. There's always a risk. But we went out to work. There's a risk. Getting hurt, accident, and there's always a risk. But we benefit. As Prof. Jamal said, do your study about it. If you feel doubt about it, do a study. There's the paper is out there. It is open paper. You can see every details in it. But for me, for those who are actually went through COVID-19 as a frontliner, frontmost as a frontliner, in fact, in emergency department, we see people die, we see people collapse, we see people, intubate patient with COVID-19, and this disease affect not only the patient but also the frontliner. The impact is high. So for me, this is another tool. We have went through our PKP, PKPB, PKD, or the PKP, right? We have went through mask, we have went through all the quarantine, but yet we are, I've said that earlier we can curb the disease, but now the numbers keep on going up further. So these are one of the methods for us. I think one of it, which have risk and which have a lot of benefit, maybe we should consider properly with this vaccine. I think that's all from me.
Thank you very much, Prof. Mabruk.
Actually, I would say don't relax on the SOP. I know it is not very easy to stay at home and not to be in close contact with people, but do your best to stay away and take all precautionary measures such that, inshallah, you stay safe, you say Alhamdulillah. And if la qaddar Allah, something negative happens, at least you are not part of it and you didn't contribute to it. You will feel clear in terms of consciousness. So this is my advice, even though it is taken long, keep sticking to the SOP. Don't try to go out, don't try to meet people unnecessarily. Being unsocial is not easy. We are all social beings, but the consequences is not easy and it's not light. This is my advice.
Thank you very much, Prof. Thank you very much, Prof. Dr. Akmal, would you like to share with us some thoughts as well?
Yeah, 1 minute. Thank you. Most appreciation to our panelists this morning, Prof. Jamal, Dr. Safwan, and Dr. Ahmad Mabruk. For our participants' information, we will have the recorded version of our program uploaded to our YouTube channel. You can visit our Centris website to look for the link. And we will see from here what would be the direction, perhaps that there would be also some needs for us to talk pertinently about each of the themes that we discussed this morning from the perspective of public health administration, clinical, and also from the fiqh perspective. Allahu Alam, but we'll see from where we would go from this one. But the most important thing is that Centris is trying to promote the culture of asking the experts. I mean, that is the most important thing. So that is why that we are here with our expert this morning, and we really benefited a lot. Jazakumullah khairul jaza, and thank you to also Dr. Abdul Razak. Assalamu alaikum.
Thank you. Thank you very much, Prof. Khuzairi, for your kind and informative words and concluding remarks. From my side, I learned a lot. We are all students to the expert, and I think this will not be the last, as Dr. Prof. Akmal Khuzairi mentioned. This is just the beginning to bring different expertise, to address, the current issues. If I make any mistake, I have tried actually as a non-medical doctor, as a non-medical, how do I say, moderator, not doctor. I have tried to cope with this, huge topic with the different words and different terminologies, and I learned a lot, alhamdulillah. If I make any mistake, that is from myself and from Shaitan. If I make any good comments, that's from Allah subhanahu wa ta'ala. But I really learned it and I enjoy it. Now I want to pass, the button to Dr. Akram. I think he is still there to conclude and end the session, because Zuhur is around the corner now.
Thank you very much, Associate Prof. Dr. Abdul Razak Hashi, for chairing this session. At the end, I'd like to thank all the speakers, Professor Dr. Jamaluddin, Dr. Safwan, Professor Dr. Ahmad Mabruk, for their input and for their speech. Alhamdulillah, we reached to the end. Also, I would like to thank the Director of the Center for Islamization, Associate Dr. Akmal Khuzairi, for the opening remarks. So we end officially with Tasbih al-Kafara and Surah Al-Asr. Thank you very much, all of you.
Okay, shukran jazilan. Assalamu alaikum wa rahmatullahi wa barakatuh.